Hello, everyone. My name is Hemanth Sanjamala. I'm one of the second year medicine resident at University of Oklahoma. Here we have Dr. Asad, one of the leading experts in the field of cardio-oncology. Dr. Asad, thank you so much for being here with us.
It's my pleasure.
All right, sir. So, some of the questions we'll be starting over with. The first one I would like to ask you is just as an introduction, what does cardio-oncology as a field encompass, and what has its integration with cancer treatment provide a different approach to patient care in the current scenario?
So, cardio-oncology is a wonderful field at the intersection of cardiology and oncology. The scope of cardio-oncology is really broad. It involves care of patients who have history of cardiovascular problems either before, during, or long after the course of their cancer treatment or cancer care. And the spectrum of cardio-oncology encompasses pretty much every subspecialty within cardiology, with an emphasis on imaging, heart failure, and most importantly, prevention and survivorship.
Awesome. I think that's very valuable. Thank you. On to our second question. How do you collaborate with oncologists and other specialists to provide a multidisciplinary approach to treating patients with both cancer and cardiovascular concerns?
I think that's a fantastic question. So, in the field of cardio oncology, like most of medicine, we have to make sure we are keeping the patient at the center and revolving all our care around that patient. So, this involves working very closely with the oncologist, with patients' primary care doctors, and all the other physicians under their care, keeping the patient's best interest and patient preferences at the center of care. So, as far as collaboration, so that involves a good knowledge about the patient's cancer, their cancer treatments, their prognosis, and the future course of cancer care, and how that intersects or integrates with their current and past and anticipated future cardiovascular problems.
Awesome. Thank you so much. And on to our next question. So, what are some of the challenges that you face with patients and healthcare professionals in educating them about the importance of cardio oncology as a field? And what do you think that we can do differently to improve this awareness in the medical community?
I think one of the challenges with cardio oncology is that in the initial growth phase of this discipline, it was thought to be just limited to heart failure in the scope of a cancer patient. Whereas now we know that the field is much broader than that. So, one of the important challenges is increasing awareness about this important subspecialty within cardiology. Another important challenge is to keep up with the ever changing cancer therapies on the horizon and uncertainty about their expected or observed cardiovascular risks.
I think that's great. Completely agree with you on this. And coming to a last question, last but not the least, what are some of the promising research developments in this particular field, and how do you see that impacting the future of cancer care and survivorship in these patients?
I think the things I am most interested in is preventive therapies we can do at the onset of cancer treatment that can impact patients' outcomes in a favorable way. Another important area of research in this space is actively screening and diagnosing cardiovascular problems such as arrhythmias early so we can actually start impactful treatments that can lead to improvement in patient care.
Awesome. I think those are some of the great insights in this ever evolving field that we're kind of all trying to find our feet in. And thank you so much for this opportunity. For more videos like this, check out the channel at youtube.com/FITsToGo. Thank you.
Thank you.